My name is Sigrún Thorsteinsdóttir and I am a postdoc in the iStopMM study at the University of Iceland. I also work as a medical doctor at Department of Hematology at Rigshospitalet in Copenhagen, Denmark. My abstract at ASH was circulating tumor plasma cells in the screened iStopMM smoldering multiple myeloma cohort. And these are my co-authors. Now, evaluation of circulating tumor plasma cells in peripheral blood has been associated with risk of progression from smoldering myeloma to multiple myeloma. Circulating tumor plasma cells may therefore be a marker for tumor burden or tumor aggressiveness in smoldering myeloma. The dynamics of circulating tumor plasma cells between risk categories in a screened cohort of individuals with smoldering myeloma has not been studied. The aims of the study were to investigate the detection and quantification of circulating tumor plasma cells in individuals with smoldering myeloma diagnosed in the screened iStopMM study. We wanted to compare the findings in smoldering myeloma to MGUS and multiple myeloma, and to associate the findings in smoldering myeloma to known clinical risk models of progression to multiple myeloma. We included individuals with smoldering myeloma, MGUS, and multiple myeloma. We performed next-generation flow cytometry to assess circulating tumor plasma cells numbers in peripheral blood. We set a limit of detection at 20 tumor plasma cells. And we found an optimal cutoff value to discriminate between smoldering myeloma and multiple myeloma. And then we found the difference in frequency of circulating tumor plasma cells between risk groups according to the PETHEMA risk stratification model and the Mayo Clinic 2020 risk stratification models, and between MGUS, smoldering myeloma, and multiple myeloma patients. Now to the results. The percentage of circulating tumor plasma cells increased from MGUS to smoldering myeloma to multiple myeloma. And so did the median percentage of circulating tumor plasma cells. And those that were above the cutoff value, the percentage of those that were above the cutoff value also increased from MGUS to smoldering myeloma to multiple myeloma. When we stratified the smoldering myeloma patients according to risk of progression in the Mayo 2020 model, we saw that the percentage where we found circulating tumor plasma cells increased from the low risk to the intermediate and to the high risk groups. However, when we found the median circulating tumor plasma cells percentage in those where circulating tumor plasma cells were detected, it did not increase significantly from the low risk to the intermediate risk to the high risk groups. And neither did the percentage above the cutoff. When we stratify the patients according to the PETHEMA risk stratification model, we found that the percentage of circulating tumor plasma cells detected increased from the low risk to the intermediate and high risk groups, and this was significant. And the median circulating tumor plasma cells was similar in the groups, but those that were above the cutoff, the percentage increased from the low risk to the intermediate and to the high risk groups. And here you can see a figure of the percentage of circulating tumor plasma cells on the left in MGUS, smoldering myeloma, and multiple myeloma. And the dotted line represent the cutoff value that we found between smoldering myeloma and multiple myeloma. And in the middle and on the right side, you can see the low risk, intermediate risk, and high risk groups of smoldering myeloma patients. And this seems to differentiate between the low risk groups and the intermediate to high risk groups, but there's not a lot of difference between the intermediate and high risk groups, perhaps because there are few patients in the high risk groups. Now, in conclusion, circulating tumor plasma cells are present in 69% of the overall population with smoldering myeloma in our screened cohort. Both the detection and numbers of circulating tumor plasma cells increased progressively from MGUS to smoldering myeloma to multiple myeloma, and we observed a similar trend with increasing risk scores in these known risk stratification models. But we don't have information about the risk of progression in these individuals yet. These results indicate that next generation flow of peripheral blood to detect circulating tumor plasma cells might have a role in the management of smoldering myeloma. However, future studies with serial monitoring of circulating tumor plasma cells are needed to further define the clinical value. And if we can use this variable, this would focus clinical care and treatments in smoldering myeloma and multiple myeloma to those who benefit the most from them, while limiting interventions in those who do not need them, because this is an analysis of peripheral blood, and maybe this can help in reducing the number of bone marrow biopsies that are needed. So, thank you.